Hi, I'm Dr. Devendra Save. I'm a psychiatrist practicing since last 22 years, and today I'm going to introduce you to a very interesting psychiatric disorder called as obsessive-compulsive disorder. Obsessive-compulsive disorder, very technically speaking, is a type of an anxiety disorder in which thoughts and actions, behaviors are involved. Now, making it very simple, it's a disorder in which there are two components. One is called as obsession, second is called as compulsion. Obsession is basically a thought which comes to a person's mind. Here, this person identifies this thought as something which is my own thought, which I don't like, but it is coming again and again, and I just cannot remove it out. It's an intrusive thought. Now, what does he do to remove it out? He does some action which satisfies this thought and helps it to get rid of it for the time being or temporarily at least. Some very common kind of obsessive thoughts are those of contamination. In fact, I had some of my obsessive compulsive disorder patients with washing obsessiveness coming to me and telling me, see doctor, everybody is behaving like me now. Now in obsessive contamination thought, the person feels that his hands are dirty or his body is dirty or some dirt has come to him. And the compulsion which comes to him because of this thought is to go and wash. So he goes and washes his hands again and again. Maybe he has a bath, but before he starts with the bath, he feels that the tub may be contaminated. So he washes the tub, the bathroom, and it becomes a ritual. He can also feel as if the dirt from outside is come on his clothes, and as soon as he reaches home, he puts his clothes for washing. He unfortunately understands that this is excessive, over, but cannot stop himself. Second type of obsessive thought is that of something which is amiss, something which I have not done rightly, and which leads to what? A compulsive checking, where the person goes on checking again and again. He feels that I have not locked properly, so he'll check the lock again and again. Maybe go down, come back home again, and check the lock, check the gas, check the windows, sign a check, and feel that the amount put is wrong. So go again back to the bank and check the amount and see. Third kind of obsessive thought is that called as obsessive rumination or obsessive thought OCD, where a person may get bad thoughts about something bad happening to his near and dear, something bad happening to himself, maybe thoughts, sexual perverse thoughts, which come again and again, in which the people, to which he can think of having sexual behavior with maybe his own relatives or even gods, goddesses. Again, to control this, he becomes very frustrated because this usually does not have an action to counter it. So this is a very frustrating kind of OCD. Treatment of OCD are of two types. Basically, it has been found that there is an imbalance of serotonin in the brain, especially in what is called as a place of the brain, which is in your basal ganglia, in the caudate nucleus, and the serotonin over there goes down, and this lack of serotonin in anterior cingulate, it goes down, and because of this the person is unable to cut off wrong thoughts. So we have medicines which increase serotonin in this area, and the anterior cingulate again gets enough amount of serotonin and the thoughts can be controlled. Apart from this, behavioral therapies are there, cognitive behavioral therapies are there, and the main type of therapy which works in OCD is called as ERP, exposure and response prevention. If you do medications and therapy together, the outcome is very good. In my cases, only therapy also works. So if you identify yourself with this disorder, please approach a mental health professional. Thank you.